We are both autistic and have ADHD. She was diagnosed late, last year. I was diagnosed early, in preschool.
I love how this video talks about the range that you might see when looking at autism spectrum disorder or ADHD and associated disorders. There definitely can be far-reaching symptoms that can be hard to put together to look at the picture of the whole diagnosis and absolutely differ based off of things like age of diagnosis or gender.
She is high masking, and I am low masking.
I also think that the field in general has really shifted in terms of neuro-affirming care and neuro-affirming support for symptoms. So for example, now we're trying as a society to raise more awareness for the whole spectrum of people and existing. And what that means is we're trying to be more aware of having low sensory input environments or trying to accommodate people who might feel the need to mask. So somebody that was diagnosed at an earlier age, therefore might feel more comfortable unmasking and really showing how they actually present, as opposed to feeling the need to change their behaviors to fit into a society that was not built to accommodate them.
She has severe anxiety, and I have low anxiety, thanks to her. She worries what others think, but I barely notice.
When we're talking about socialization and social cues as it relates to autism, it really is unfair to think of it as just being socially unaware or awkward. There are absolutely higher functioning people on the spectrum that might overanalyze or feel really anxious in social situations, even though it presents and appears that they're very high functioning and can adapt to those social contexts quite well.
Some of this is how she raised me versus how the world treated neurodivergent people back then.
Completely agree with his point too about upbringing and society's overall attitude really influencing how people on the spectrum interact with the world around them.
But I am also learning that some of it is male versus female, and that it is much worse for people of color or anyone who presents differently.
Women are less likely to be diagnosed right away. Women and girls especially are more adept at masking or kind of hiding behind high-functioning social interactions, so it might be harder to spot. And then, of course, as he mentioned, people who present differently or who are of different racial backgrounds are often underrepresented and underdiagnosed as it pertains to autism spectrum disorder. I completely agree that society overall is shifting in a very positive direction when we talk about neuro-affirming support and overall autism acceptance and awareness, but there's always more that we can do, and I'm excited to see what happens next.